We are now in the midst of the second wave of the COVID pandemic. Unlike the first wave, when we were not aware of how this virus is transmitted, we now know that the transmission of the virus is through air. So, when an infected person, who may or may not be symptomatic, coughs or speaks, then he or she releases liquid particles into the air. The larger ones are called droplets and the smaller ones are called aerosols. The larger droplets travel a short distance and then fall down towards the floor or the surfaces, whilst the smaller ones linger on into the air. Whilst the scientific community is debating whether it is transmitted via droplets or aerosols, the evidence goes more and more towards aerosols. For example, in Florida, an infected person actually transmitted the virus about 15 feet away, clearly showing that this transmission is via aerosols. What does this mean? Thus, if an individual has coughed and released some virus particles in the form of aerosols into a room, and if another person enters into the room after a shorter period of time, the viruses could be lingering in the air. Today, while we talk so much about the pandemic, we should not forget about tuberculosis, which affects a large proportion of our population in the country. India accounts for 26% of TB cases in the world and the highest number of deaths because of tuberculosis. Data shows that today India has about 28 lakh TB cases. Vaccines, in a way, is a mode of preparing our immune system in case we do land up with a real infection. As far as diseases caused by infectious viruses are concerned, be it measles or smallpox, vaccines have been very effective in their control. So do we hope that with vaccination we may be able to control this pandemic. However, we need to bear in mind that no vaccination is 100% effective, but it would reduce the manifestation of symptoms and the mortality rate. Now, talking about indoor ventilation, when one is in a closed room, then the risk of transmission of any infectious disease transmitted via air is high. When an infected person is present in a room, then he or she releases those particles containing the viruses, which do not find their way out if there is no good natural cross ventilation or good mechanical ventilation. By mechanical ventilation, I mean the use of air handling units or air conditioning systems. So a closed space naturally has a higher risk of transmission. The risk would depend upon the kind of mechanical ventilation system that is being used and how well it is being maintained. There is a concept of air changes per hour, which means how many times fresh air replaces the existing air in the room in 1 hour. Now this depends on the volume of air in the room, which depends upon the size of the room and the height of the room and the speed with which air comes in, either through an inlet of a mechanical system or through windows and doors. A good cross ventilation can give about 40 to 50 air changes per hour, but generally mechanical air ventilation system could give anywhere between 6 to 12 air changes per hour. So as you can see, the best kind of ventilation would be natural cross ventilation. Again, it is how well these ventilation systems are being maintained. There can be centralized ventilation systems, which means that same air handling unit passes through multiple rooms. Now, if there is somebody who is infected in one room, then there is a risk of transmission of that infection to another room through the air filtration systems. Then we need to have filters when the air enters into a room. These filters need to be cleaned and replaced regularly, otherwise these infectious particles remain in the filters, and when the air is blown in with a lot of force, these infected particles could enter into the room. So all in all, air ventilation is a very complex process, depend on numerous factors ranging from temperature, humidity, the size of the room, the type of ventilation used, and therefore a proper study is required before we decide on the air ventilation systems. The most important thing is masking. When we wear a single or a double mask, the risk of getting infected reduces substantially. Second is washing of hands. As I mentioned earlier, the droplets could drop down onto surfaces, and if we were to touch that surface unknowingly and then touch our face, we would be at a risk of transmission. So we may use air disinfection technologies using air filtration and air handling units. But remember that by the time the air is replaced through these air handling units, the infectious particles remain in the room and could infect another person who enters or is present in the room. So we can use standalone air disinfection units. Some of these air disinfection units release ionized particles into the environment, which would destroy the viruses if they come in contact with them, or rather neutralize them. But these ionized particles cannot differentiate between anything they come in contact with and the viruses. People advocate use of UV lights, which damages the genetic material of the cell, but it does not again differentiate between human cells and the viral cells or the bacterial cells. And UV lights only acts on what it comes in its path. On the other hand, we have newer technologies wherein air is sucked into a unit which contains special plasma coils, which totally shreds whatever is sucked in. So for example, if a viral containing particle is sucked into these units, within nanoseconds, this is thoroughly destroyed, including the viral DNA, viral RNA, and fresh air is released back into the room. This possibly seems to be one of the good technologies to be used in small rooms. This is a novel Irish technology which is patented and called as nanostrike.
Subscribe to Midday India. Get direct notifications on all our videos by clicking on the bell icon.